Hello, Myo family. The question or the topic of the day today is why is myofunctional therapy important? I've had several emails that I've answered recently, so I thought this would be great. And a lot of it comes from a scenario like a parent takes a teenager to the doctor and finds out that the kiddo has a tongue tie, and then the doctor, unbeknownst to the importance of the whole process of myo, will tell the mom, hey, you're going to want your kiddo to have a session or two of myofunctional therapy for the release. So in that situation, I feel like that provider might have heard about myofunctional therapy, might know a little bit about it, but doesn't really know a whole lot, because a session or two of myofunctional therapy before a tongue tie release doesn't do a whole lot, okay? It's just piecemeal. So it might accomplish a couple things that are important before the release, but it is not fully, it's not full rehabilitation type therapy. So in my practice, I don't work with those clients because I know the importance, and I wholeheartely believe in, all the way to my toes, how important it is to do that whole process, which starts with, prepping for a frenectomy. It works on the strength and the coordination and the neuromuscular connections here, of those muscles. You have to deprogram to reprogram, we've got behavior changes and modifications and lots of different things going on. And I work with clients to get to the root cause. So I don't want to put Band-Aids on bullet wounds, because I know that bullet wound is a gaping, oozy sore, years later. So of course, speaking creatively, theoretically, whatever, it's not that's just not going to be helpful. So let me say, why is myofunctional therapy important? Because it helps in that process. So to get to here, we have to do all of this stuff, all the way across here. So you guys, we can't build a house on quicksand, okay? We need a good solid foundation. A lot of the things about myofunctional therapy are building blocks. So you have to do this before you move on. And for some people, that can be a really a big struggle. For those of you who are not motivated, or you don't follow through, you make excuses, that kind of stuff. So it's really important before you embark on the myofunctional therapy journey, you've got to get real with yourself. Like, am I going to follow through and do this? Because it's kind of, you need the whole enchilada, and myofunctional therapy is going to help with things like the tongue tie, but also it's not just all about the tongue tie, you guys. It's about oral function and the improvement of that. So I hope that helps. I know that's a lot for parents to take in when they're all of a sudden like, oh my gosh, oh snap, my kid has a tongue tie, and now we're being told that we need this therapy. But you guys, it is the most important thing. And I think the most important thing, even more important than that tongue tie, is understanding the importance of correct craniofacial growth, why your child needs to be nasal breathing, all of those type of things. And we just absolutely cannot fix that in one appointment. So there you go. That's your food for thought for this week. And I'll be back next time answering another great question.